Okay, bonjour et merci de vous être rejoints à nous aujourd'hui. So, today we will hear from Canada's Chief Public Health Officer, Dr. Theresa Tam, the Deputy Chief Public Health Officer, Dr. Howard Njoo, our Minister of Health, Patty Hajdu, the Minister of Science, Innovation and Industry, Navdeep Bains, Canada's Chief Science Advisor, Dr. Mona Nemer, et le Président du Conseil du Trésor, Jean-Yves Duclos. Dr. Tam, please.
Bonjour à toutes et à tous. Good afternoon. I'll start with the latest numbers on COVID-19 in Canada. There are now 40,190 confirmed cases, including 1,974 deaths. To date, labs across Canada have tested over 620,000 people, with over 6.5% of these testing positive. Although we are still facing considerable challenges, from the need to extinguish outbreaks and ramping up testing and tracing to root out and manage persistent chains of transmission in community settings, today is a great day to consider the progress we've made. There are still a lot of unknowns, but the pace and expanse of evidence-based discovery and science innovation is inspiring. From discovery and genetic sequencing of the virus in January to building our understanding of COVID-19 disease characteristics and spread through tried and true applied epidemiological and public health investigation, we've progressed in leaps and bounds. If we reflect back on prior pandemics in the recent and more distant past, we can see some of the advantages of a more virtually connected, technology-powered society. But this, like everything else, is made better, faster, and more powerful when we work together towards a shared goal. We've seen the power of solidarity in a connected world, with researchers collaborating across borders, data trackers scrubbing the web to share up-to-the-minute stats and charts for all the world to see, and virtual collaboration platforms sharing accelerated research findings on virus strain information and pre-publication scientific studies. It is hard to imagine where we would be without this rapid and open sharing of research and scientific advancement on biomedical, social, and policy countermeasures. While one of the downsides of a highly connected world is the ever-present risk of emerging diseases that spread rapidly around the world, today's announcements give us hope for our future. In a world that is connected and united towards a goal, and with brain power that is funded, supported, and trusted, we can reach a whole new level of capacity to respond to infectious disease threats now and into the future. Go science! Thank you.
Thank you very much, Dr. Tam. Et maintenant, je donne la parole à Dr. Howard Njoo. Dr. Njoo, s'il vous plaît.
Merci. Bonjour. On commencera par les derniers chiffres sur la COVID-19 au Canada. Le pays compte maintenant 40 190 cas confirmés. Dans ce nombre, on déplore 1974 décès. À ce jour, les laboratoires de l'ensemble au Canada ont testé plus de 120 000 personnes et les résultats se sont révélés positifs pour plus de 6,5% d'entre elles. Bien que nous faisons toujours face à des défis considérables, de la nécessité d'éteindre les foyers d'éclosion et d'accélérer les tests de dépistage et le traçage pour éliminer et gérer les chaînes de transmission persistantes dans les collectivités, aujourd'hui est un jour tout indiqué pour examiner les progrès réalisés. Il reste encore beaucoup d'inconnus, mais l'étendue des découvertes fondées sur les preuves ainsi que les rythmes auxquels elles se sont produites et des innovations scientifiques sont inspirants. Depuis la découverte du virus et de son séquençage génétique en janvier à la compréhension des caractéristiques et de la propagation de la COVID-19, en passant par la conduite d'investigations épidémiologiques et de santé publique appliquées et éprouvées, nous avons fait des pas de géant. En nous penchant sur les pandémies antérieures, récentes et plus lointaines, nous sommes à même de constater certains des avantages que procure une société connectée virtuellement et axée sur la technologie. Or, pour tout le reste, cette société est meilleure, plus rapide et plus forte lorsque nous travaillons ensemble à la réalisation d'un objectif commun. Nous avons vu le pouvoir que la solidarité peut avoir dans un monde connecté. À cet égard, nous n'avons qu'à penser aux chercheurs qui collaborent au-delà des frontières, aux chasseurs de données qui investissent le web pour mettre les statistiques et les graphiques les plus récents à la disposition du monde entier, ainsi qu'aux plateformes de collaboration virtuelle qui communiquent les résultats de la recherche accélérée concernant de l'information sur les souches de virus et des études scientifiques en phase de prépublication. Il est difficile d'imaginer où nous en serions sans cet échange rapide et ouvert des renseignements relatifs aux recherches et aux avancées scientifiques sur les contre-mesures biomédicales, sociales et politiques. C'est l'un des inconvénients d'un monde hautement connecté et le risque toujours présent de voir apparaître des maladies qui se propagent rapidement dans le monde entier. Les annonces d'aujourd'hui nous donnent de l'espoir pour notre avenir. Dans un monde qui est connecté et uni pour la réalisation d'un objectif commun et dont l'intelligence est financée, soutenue et dûment reconnue, nous pouvons nous donner des capacités d'une toute nouvelle ampleur pour répondre aujourd'hui comme demain aux menaces des maladies infectieuses. Allez la science. Merci.
Merci, Dr. Njoo. Now, Minister Hajdu. Patty, please.
Thank you very much, Chrystia. Well, good afternoon, everybody. The question I hear the most often, no matter who I'm speaking to, and often in different words, is essentially, when will things go back to normal? And this is a simple question with a very complicated answer, and one that we need science to better understand the solutions for. What is the virus about? How do we control it? How can we defeat it? These are all parts of the answer to when will things go back to normal. On sait qu'il y a des gens qui ont le COVID-19, mais qui n'ont jamais été diagnostiqués parce qu'ils n'ont pas eu, ou presque pas eu, de symptômes. On sait aussi que les analyses de sang peuvent détecter des anticorps contre le virus et nous dire qui dans nos communautés a été infecté. So to better understand the rate and spread of infection, we need data and research that will help us understand the extent of the community spread of the virus. We also need a better sense of what to expect in the coming months during a possible second wave of infection. And we need a better picture to help us guide public health decisions that will be needed as we ease restrictions that are in place right now. This understanding of Canadian exposure is critically important to take the right steps at the right time. And that's why this morning the Prime Minister announced an important Canada-wide study to track COVID-19 infections. I want to thank Dr. David Naylor, Dr. Catherine Hankins, and Dr. Tim Evans for helping us to coordinate and conduct this research that will result in our country being better equipped to plan over the next few months. And this very important research will contribute to our country's ability to manage COVID-19 well into the future. I also want to highlight important investments that we also announced this morning. Part of the research funding through the Canadian Institutes of Health Research will help better understand the mental health challenges that Canadians are facing as a result of living with COVID-19 and how and what measures can help with these particular challenges. Other parts of the funding will accelerate the development and testing of promising vaccines, therapeutics, diagnostics, and measures to contain the spread of the virus. These are all important steps that we're taking to help us fully understand the virus and how Canadians can continue to live with the virus in the safest and healthiest ways possible. The more that we understand it, the sooner that we will reach the new normal. I want to thank the research and academic community across Canada that is working so hard in so many ways to help us get through this difficult time and have the science and evidence we need to take those important next steps. Thank you very much.
Okay, thank you, Patty. And now we will hear from our Minister of Innovation, Science and Industry, Navdeep Bains. Nav, please.
Thank you very much, Chrystia. Over the past weeks, we've been working hard to mobilize the genius of Canada's industrial and research communities to tackle this global pandemic. Je suis très reconnaissant à tout le monde qui donne de l'aide, les chercheurs, les entrepreneurs et les grandes et petites entreprises. Nous travaillons fort pour promouvoir la recherche prometteuse d'un vaccin et d'un traitement pour contrer le virus. In 2018, our government invested in the largest amount in Canada's history towards fundamental science. Drawing upon that foundation, we're unleashing the power of Canada's world-class researchers and scientists in responding to this crisis. I'm pleased to announce an investment of $40 million that will allow Genome Canada and CGen to coordinate a COVID-19 genome sequencing effort across Canada. Canadian scientists will sequence 150,000 virus samples and 10,000 human host genomes to understand how the human body responds to the virus and to track the evolution of this virus as it spreads. Canada is already an established international leader in genomic research. The results of this work will be accessible to researchers around the world to move ahead with this global fight against COVID-19. We're also providing the National Research Council with $29 million for the Human Health Therapeutics Research Centre facility in Montreal, and building on the ongoing work to ready the facility for the production of vaccines for clinical trials. This funding will provide infrastructure and operational support to prepare vials for individual doses as soon as a vaccine becomes available. We're also announcing a further investment of $23 million in an important work towards the University of Saskatchewan's International Vaccine Centre. This funding will support preclinical testing and clinical trials of COVID-19 vaccine candidates. Next, we're also providing $600 million towards the Strategic Innovation Fund, the COVID-19 stream, to deliver direct support to Canadian companies for large-scale projects. This will help companies with promising vaccine treatment for candidates to move to clinical trials, as well as expand Canadian biomanufacturing opportunities so we can manufacture a vaccine in Canada when one becomes available. Grâce à ces investissements et aux mesures que nous avons prises au cours des dernières semaines, nous nous assurons que le Canada puisse développer, tester et fabriquer un vaccin et des produits thérapeutiques pour les Canadiens. Canada has some of the best scientists in the world, and I cannot thank them enough for their hard work, their ongoing dedication and commitment to addressing this mutual cause. So once again, thank you very much. Merci beaucoup.
Okay. Thank you, Nav. And now we will hear from Canada's Chief Science Advisor, Dr. Mona Nemer.
Merci beaucoup. On n'a jamais autant parlé de science collectivement et attendu avec autant d'impatience les résultats de la recherche pour informer notre présent et anticiper notre futur immédiat. These are indeed unprecedented times. Science has been our best weapon in this pandemic, but we need more scientific knowledge about this new virus to overcome it and to ensure societal well-being. For example, we don't know how many people were infected with COVID-19 because it turns out many individuals may have been infected but show no symptoms. The current widespread testing, or PCR test, as you know it, checks the presence of the virus. So it provides important data on who is infected at a given time, which is now, when you do the test. Serology or immunity testing tell us how quickly, before I should maybe explain it. So serology testing actually checks for antibodies that are generated in response to an infection. So they tell us who has already had exposure to the virus, who was infected but didn't know it. Together, the two tests will give us a better idea of the rate of infection in the population. Serology testing will also tell us how quickly immunity develops and also fades. And this is important in guiding our recovery strategies. Other important information that we're still missing is how quickly the virus changes or mutates to escape detection, and whether certain individuals are more susceptible to infection or less able to overcome it. This is why the Genomic Initiatives is important. It aims at sequencing several viral isolates, as you heard from the minister, and determining the DNA sequence of infected individuals. Together, the immunity and the genomics initiatives will guide vaccine development and help prevent future infection. Un des défis majeurs de cette pandémie est de comprendre la réponse immunitaire, le pourcentage de la population qui a été infectée et pourquoi certains groupes sont plus vulnérables à la maladie que d'autres. Les réponses à ces questions vont nous fournir les connaissances dont nous avons besoin pour lutter contre la maladie et mieux planifier l'avenir. C'est pour cela que les investissements annoncés aujourd'hui vont bénéficier à tous les Canadiens. So today's announcement to enable immunity testing, genomic sequences, disease modeling, and vaccine research and development provide much needed support for the research that will help us win the war against COVID-19 and will help our governments make evidence-informed decisions that will ultimately benefit us all. Thank you.
Thank you very much, Dr. Nemer. Et maintenant, je donne la parole au président du Conseil du Trésor, Jean-Yves Duclos. Jean-Yves, s'il vous plaît.
Merci, Chrystia. Il est clair que nous faisons présentement face à une urgence qui est à la fois sanitaire, économique et sociale, et j'aimerais profiter de l'occasion pour fournir une mise à jour rapide sur les 3 piliers de notre réponse à la crise et à l'urgence économique. Ces 3 piliers sont la prestation canadienne d'urgence, les prêts d'urgence pour les petites entreprises et la subvention salariale d'urgence. En date du 21 avril, 8,9 millions de demandes de cette prestation canadienne d'urgence ont été traitées pour un total de 6,8 millions de demandeurs à l'échelle du pays. Pour le compte canadien d'urgence pour les petites entreprises, en date d'hier, 351 000 petites entreprises avaient reçu leur approbation de demande de prêt. Et un rappel pour les subventions salariales d'urgence. Depuis mardi, l'Agence de revenus du Canada met à la disposition des entreprises un site web où on retrouve aussi un calculateur pour que les entreprises puissent préparer et planifier leurs demandes de subventions salariales d'urgence. Les demandes pourront commencer à être déposées, soumises dès lundi prochain et à partir de la semaine suivante, soit le mardi, le 5 mai, on s'attend à ce qu'un grand nombre de réponses soient communiquées aux entreprises et que les paiements suivent rapidement. Merci, Chrystia.
OK, merci Jean-Yves et on est prêt à répondre à vos questions. Carl.
Thank you, Deputy Prime Minister. So as usual, we'll start with 3 questions on the phone, 1 question, 1 follow-up, and then we'll turn to the room. Operator.
Thank you. Please press star 1 if you have a question. Veuillez appuyer sur étoile 1 si vous avez une question. Notre première question est de Émilie Bergeron de l'agence QMI. À vous la parole. Please go ahead.
Oui, bonjour. Ma question est pour Madame Nemer ou Dr. Tam. En fait, on parle de l'importance aujourd'hui de développer des tests sérologiques pour savoir combien de personnes ont été touchées, combien de temps ça prend à développer une immunité à la maladie. Par contre, il y a déjà des provinces qui commencent à parler de réouvrir certains pans de l'économie, de réouvrir certains commerces graduellement. Est-ce qu'il ne faudrait pas attendre le résultat de ces recherches-là, d'avoir plus d'informations pour commencer à rouvrir l'économie?
OK. Dr. Nemer, est-ce que vous voulez commencer? Peut-être Dr. Tam ou Dr. Njoo va ajouter quelque chose après.
Je peux commencer. Évidemment, pour retourner au travail, ça prend. Il y a certains, disons, éléments qui doivent être respectés. Le premier, c'est que les infections sont sous contrôle, qu'il n'y en a pas plus, que le système de santé n'est pas débordé. Et le troisième, qu'on est capable de tester les nouveaux cas et de pouvoir les gérer en conséquence. Alors, dans une certaine mesure, vous pouvez dire que ça n'a pas besoin d'attendre les tests immunologiques. Évidemment, les tests immunologiques vont continuer à nous aider à comprendre l'immunité, la vaccination et le potentiel pour réinfection.
Émilie, en suivi?
Oui, donc la priorité finalement, avant de rouvrir l'économie, si je comprends bien, ça serait plutôt d'augmenter les capacités de dépistage, donc de faire des tests.
Oui, c'est Dr. Njoo. Oui, c'est très important de continuer avec nos efforts d'augmenter la capacité pour dépister actuellement les cas qui sont là dans toute la population. La recherche pour peut-être les tests sérologiques, c'est pour peut-être avoir une meilleure idée au futur pour, comme on dit, c'est quoi la portée et l'ampleur de le virus et l'infection partout dans la population. Mais pour nos efforts maintenant, pour prendre des décisions, pour peut-être lâcher un peu les mesures de santé publique, c'est plus basé sur qu'est-ce qui se passe actuellement avec les dépistages de tests, des tests pour toute la population actuellement.
Thank you, Doctor. Operator, next question.
Merci. Next question is from Bill Curry from the Globe and Mail. Please go ahead.
Hi there. A couple questions for Ms. Freeland. Today, the Federation of Canadian Municipalities said that cities are going to need between 10 and 15 billion just to meet their operational costs, and they're hoping that the federal government will provide that directly to them. So I was hoping you could respond to that. And then also the fact that we're starting to see several provinces detailing their rollouts for reopening the economy while others are in different positions and not able to do that. Are you concerned that that could create some public confusion about what's allowed and what's not allowed?
Well, thank you very much, Bill. On the FCM, we as a government, and I personally, together with Minister McKenna, and really many other ministers, have been in very close touch with the FCM and with mayors of municipalities across the country. I had my most recent phone call with the big city mayors last Friday. We are very aware of the urgency of the situation that municipalities across the country face. They are providing essential services, and at the same time, they have seen their revenues fall precipitously through no fault of their own. I think it's important for all of us to also appreciate that having city services in place is absolutely essential as we think about a potential for restarting the economy. The work that cities do is essential to keep us going now, and it is really essential that the cities remain up and running for our economy eventually to get back up and running. So we are very aware of the city's concerns, very alive to them. I know that the cities are also having conversations, as they ought to do, with the provinces. And I would just add that we are also aware that the cities face an additional constraint, and that is the limitations that they have on borrowing. To your second question, Bill, about some provinces starting to talk about when they may begin to ease lockdown restrictions. The Prime Minister has been very clear from the outset that Canada is a vast country and conditions across the country differ widely, just as the provisions and the timing of provisions that have been put in place for lockdown have been different, and appropriately so, across the country. The pace at which the country moves to the next stage will inevitably be different too. I do really want to emphasize, however, as we have heard from the scientists with us this morning already, it is so essential that we not move to prematurely lift restrictions currently in place. Last week, we heard from Dr. Tam that there were reasons to be very, very, very cautiously optimistic about what Canadians have collectively achieved through the country's national discipline and self-sacrifice. Let's not squander that by prematurely lifting the restrictions. And I don't know, Dr. Tam, if you want to comment further.
I think together with all the other chief medical officers, we are looking at some of the epidemic criteria, if you like, for consideration. And as Dr. Nemer said, you want to ensure that the epidemic, that first wave, is under control and that your health system capacity is there should there be a surge, and that you have the ability to test, detect cases, and do all the contact tracing. So, and for workplaces to return, for example, and for our essential services, ensuring that the workplace has the necessary plans for minimize the introduction of infection and spread. So there's a whole host of areas where jurisdictions will look at those and under their own context as to whether they're at that sort of specific moment in time. But again, all chief medical officers are advising caution, the sort of moving very thoughtfully and informed by the data that we have.
Bill, follow up.
Thanks. And just to be clear on cities, the pattern is the government has sometimes said when they're working on a package, whether it be for seniors or students. Is that the case with cities? Is the federal government working on some kind of a fiscal response to the city's requests?
I chose my words with some care, Bill. We very much understand the extremely difficult position in which cities find themselves. We understand this is through no fault of their own. We understand the absolute necessity of having our cities up and running, both to keep us going in the lockdown phase and so that we can be ready to restart the economy. We also know that cities have constraints on their own ability to borrow. We know that the cities are having conversations with the provinces as well, which is appropriate too.
Thank you, Deputy Prime Minister. Operator, next question, please.
Thank you. Notre prochaine question est de Hélène Buzetti, Le Devoir. À vous la parole.
Yes, hello. I believe my question is for Minister Hajdu. We see seniors dying in large numbers. A few weeks ago, Ottawa recommended that workers do not switch from one work area to another, but they still do. Ottawa suggested that seniors and those attending to them be tested every day. It's still not being done. So I'm just wondering if we have come to a point where Ottawa will have to take control at some point to maybe establish some federal national standards in senior homes.
Well, first of all, thank you for the question, and thank you for shining a light on what undeniably is one of the most tragic aspects of the COVID-19 epidemic in Canada, which is the loss of enormous life for seniors that are living in long-term care homes and that are oftentimes not only experiencing high rates of illness and death, but are also, by the way, significantly isolated from their loved ones through this experience. It is an emotional hardship, it is a physical hardship, and it is truly hard to listen to those stories and watch those stories, I think, as any Canadian would say. In terms of the next steps for provinces and territories, we've been consistently there for provinces and territories in terms of the kinds of resources and supports that might help them manage through this crisis. We obviously have provided support financially. We have provided guidance, as you've rightly pointed out, and we've also assisted in terms of human resources that they may need through a variety of different mechanisms. We continue to work with provinces and territories to understand what more we can provide at the federal level to get through this crisis. But I think the other question that sort of is the foundation of your question is, should this be a temporary measure, or should we be looking to long-term reform, if you will, of long-term care facilities and how we take care of the people in our lives that have taken such good care of us in many cases? And I think the answer is yes. I think there should be a long-term national project to examine long-term care homes and how we can better support long-term care homes at every level of government to make sure that people who are living there are protected and can live their lives in dignity and safety. Thank you.
And just to follow up to that, do you believe that would be done through some federal national standards?
I can't, at this point, obviously in the middle of the crisis, predict exactly what that would look like, but I would say that there is a significant appetite of Canadians and of politicians to fix this situation once and for all for seniors all across the country and for their families who love them. Because as I was saying, I had a very good conversation with Minister Dix yesterday from the province of British Columbia, and he reminded me that we can't keep our seniors isolated forever, that this is not a long-term solution to say that people cannot have visitors in the long-term care homes, that in fact loneliness is one of the predicting factors of earlier death, and that it is also a factor that we have to consider as we learn to live with COVID. And so I think there is an urgency to this, and I look forward to that continued work with my colleagues at the provincial and territorial level, and indeed at the local level, because as we know, there are many different players in the care of seniors all across this country. But I think what we can all agree about is that we must do better.
Thank you, Minister. I will now turn to the room, starting with Mike from Global.
Hello, Minister Duclos. My question today is about the access to information departments that the government has. And they've been shut down or closed. They've been very limited during this past couple of weeks. Do we know why this has been allowed to lapse or get reduced?
Well, thank you very much. And two important things related to your question. The first one is the absolute importance of information in the current context. We are having discussions every day in this particular place, in particular around the value that journalists and the media add to the importance of information that Canadians expect and need in the current crisis. We're also, and that's a second thing, we're also mindful that public servants are also going through difficult circumstances. So they are working in often challenging personal and professional environments while delivering important services, including information to Canadians and to the media in particular. So this work is ongoing. There would probably be challenges in some particular specific context, which we are addressing as quickly as we can. But if you, in particular from the media, notice that there are ways that we could do and should do better, we would be, of course, most grateful to hear from that.
Okay, thank you. And do we know when it's going to get back to normal? I know it's difficult to say at this time.
Well, it's a broader conversation. Of course, public health guidance also applies to public service and public servants in particular. So we want to guarantee that the safety and the health of our public servants who are working very hard. We also need to do everything that we need to do as a government to provide the level and the quality of information that you, journalists, and Canadians in general demand and need.
Evan Gallagher, CTV News. So with this, more than $1 billion going towards research, there's also a task force that's being set up. How will that task force advise governments in the process of reopening up the economy? Like, what are the steps that will be involved as part of that?
I can try. My understanding, this is a scientific and medical task force that's charged with making sure that the methodology being used across the country is, systematic and coordinated, and also ensuring that the tests, the material that's being used is actually well validated, that the data, will be able to be actually interrogated across the country. So that's the charge of the task force.
And in terms of a vaccine, what stage are Canadian researchers in right now, and what are the steps to get towards approval of a vaccine that Canadians can use?
So I can start off with that, then of course Dr. Nemer can speak to it. Today's announcement has three critical components to it. One is what we just highlighted right now with regards to tracking and testing. That's critical for us to understand how this virus is impacting the broader population. Second component, as you asked in your question, is with respect to vaccine and therapeutic development. And right now, the investments that we're making and the announcement today really reflects early stage clinical trial initiatives. And so it's difficult to say with any certainty how long this would take. There's some estimates that say 12 months to 18 months. And we know that our approach is very open. We're collaborating with other jurisdictions. Dr. Mona Nemer is working with other allied countries and partners as well. Same with Dr. Tam, the WHO. So our goal here is to make sure that we provide the third component of today's announcement, which is building domestic capacity for those clinical trials. And then ultimately, when we do find a vaccine, and if we're fortunate enough to be in that position, to be able to have a facility here that can produce the doses. So that's the announcement today. There's three components to it. Timelines are not clear, but those three elements are essential. And we really are leveraging world-class scientists and researchers to drive this agenda. One thing that Canada or Canadians can be proud of is that we've made significant investments in science. In 2018, we invested billions of dollars into research it's part of our budget, and we recognize that that's paying dividends. And we were able to develop local science expertise and also attract global scientists as well that are working here on a lot of these initiatives. And so the focus is really, again, on those clinical trials and making sure we build up the clinical capacity for those tests early on in the clinical trials, and then ultimately have the domestic capacity for mass biomanufacturing.
Thank you, Minister. CBC?
Hi. First question I have is, I believe, from Minister Bains. Provincial governments are in talks with several companies developing apps for digital contact tracing. How concerned are you about a patchwork of apps across the country causing confusion and reducing the efficacy of contact tracing?
It's a great question you ask, because when we talk about reopening the economy and we talk about what different jurisdictions are thinking, I think we need to be mindful of two components. One is testing, and we need to do more of that. And second is looking at different solutions around contact tracing or apps that may assist us with that reopening process. There are many Canadians that are engaged in this process. Many provinces are looking into this solution as well. We're working with and engaging with different organizations across the country as well. From our perspective, really the focus is on to avoid a patchwork, as you highlighted. How can we have scalability and adoption? And in order to do that, we need to address the core issue of privacy. We need to make sure that Canadians feel confident that this tool or this solution protects their personal privacy. And those are the issues that we're engaged with different organizations that are looking at these solutions.
And Minister Duclos, we're hearing from some small businesses that they're having trouble with accessing some of the government-mandated loan programs through their banks. So what can the government do to incentivize banks to give these loans to small and medium-sized businesses rather than large companies?
That's a very good and timely question. As I was saying earlier, the Canada Emergency Business Account, which is designed for small businesses, has been launched about 12 days ago, and already now 351,000 small businesses have been granted their loans. So it's a program that, of course, has been launched by the federal government, but as you also signaled, it's supported widely by banks and in my particular province by Mouvement Desjardins, which is a credit union. So our understanding from the ground is that the speed and the efficiency of the relationship between small businesses and their banking institutions, that's going well. But there would certainly be individual challenges, as we expect for such a large program and a large impact. And so if small businesses in particular see specific challenges in their particular circumstances, we would certainly invite them either to contact their institution, their financial institution, or to seek the help and the advice of their members of parliament who have been informed and who are very supportive of the needs of their small businesses.
Is there any follow-up that you're going to do with the banks? Because this is the money that you're giving them.
That's another excellent question. And indeed, the Minister of Finance and the Minister of Small Businesses are talking to banks every day, making sure that this initiative is efficiently managed, because we know the urgency. It's called an emergency business account because it's really emergency. The small businesses, we talk to them every day, feel the pain that this crisis is causing to them. So we're having discussions with the banking sector every day on all sorts of important areas. But again, there might be local cases, local conditions where things should be done better, and we would invite small businesses to make those cases known.
Thank you, Minister. Friendly reminder to stick to one question and one follow-up. We'll now turn back to the phone for 3 questions. Thank you. Operator?
Merci. La prochaine question est de Micheline Laflamme de Radio-Canada. À vous la parole.
Merci beaucoup. Alors, pour permettre un assouplissement des mesures de confinement, vous avez indiqué, Dr. Tam et Dr. Njoo, qu'il fallait augmenter le nombre de personnes qui étaient testées quotidiennement. Je pense que vous aviez parlé de 50 à 60 000 tests par jour. Alors, est-ce que c'est encore la cible que vous souhaitez pour contrôler la situation? Et combien de temps faudra-t-il au Canada pour atteindre cette cible?
OK, Dr. Njoo.
Oui, comme Dr. Tam a dit hier, ça, c'est la capacité pour faire les tests tous les jours. C'est à peu près 60 000. Mais qu'est-ce qu'il faut faire actuellement pour dépister la population? Ça dépend de l'épidémiologie dans chaque province et territoire. Au fur et à mesure, s'il y a des éclosions, des foyers, c'est très important de tester tout le monde impliqué, peut-être dans un établissement de soins de longue durée. Donc, c'est difficile d'avoir comme une cible exacte. Il faut exactement avoir un certain niveau de tester la population parce que ça dépend qu'est-ce qui se passe actuellement aujourd'hui. Je pense que les provinces continuent avec leurs efforts d'augmenter la capacité. On a vu en Ontario, aussi au Québec, ils ont fait des bons efforts et maintenant, je pense que la priorité, c'est vraiment qu'est-ce qu'il faut faire dans les établissements de soins de longue durée. Hier, l'Ontario, je pense les autorités ont indiqué que c'est très important de tester peut-être tout le monde dans un établissement touché par la COVID-19. Et c'est sûr que ça dépend qu'est-ce qui va se passer dans les journées suivantes. Si l'Ontario, les autres provinces ont besoin peut-être plus de tests. Mais pour l'instant, c'est pas vraiment, comme on dit, un niveau, un chiffre exact. C'est vraiment, ça dépend de qu'est-ce qui se passe de tous les jours. Merci.
Micheline, en suivi?
Oui, mais quand même, je pense que je sais pas si c'est aujourd'hui, mais on parlait peut-être qu'il y avait sur l'ensemble du pays, là, environ 20 000 tests qui étaient faits par jour et qui, si on veut vraiment penser à un assouplissement des mesures de confinement semblant de retour à la normale, à quel niveau il faudra augmenter la cadence outre les soins de longue durée là, dans les CHSLD?
Oui, c'est une bonne question. Qu'est-ce qui se passe actuellement? On voit dans les 2 provinces les plus touchées, l'Ontario et le Québec, c'est qu'en effet, il y a comme deux situations différentes. Il y a les situations dans la population en général et aussi qu'est-ce qui se passe actuellement dans les établissements de soins de longue durée. Donc, c'est sûr, il faut toujours garder comme une priorité qu'est-ce qu'on fait parce que c'est pas seulement une question de dépister tout le personnel, les résidents dans les établissements, mais aussi renforcer les bonnes pratiques d'hygiène, aussi peut-être la restriction des visiteurs, mais aussi renforcer les bonnes pratiques pour la prévention et contrôle des infections dans les établissements. Pour le reste de la population, ce qu'on voit actuellement, c'est peut-être il y a des indications que peut-être le nombre de cas tous les jours, ça commence peut-être à diminuer un peu dans le reste de la population. Et c'est quelque chose qu'il faut, suivre étroitement parce que au futur, ça dépend si on a vraiment la confiance, c'est vraiment ça reste avec les autorités de chaque province et territoire. Si on a des indications que les cas commencent à diminuer dans la population générale. On a aussi une bonne capacité pour surveiller, dépister. S'il y a peut-être des cas isolés, il faut toujours faire isolement, faire le traitement et aussi le traçage des contacts pour tous les cas. Peut-être ça peut permettre peut-être assouplir quelques mesures de santé publique. Mais ce qu'on a dit déjà, et on répète et souligne, c'est très important pour tout le monde, toutes les autorités sanitaires à travers le pays, d'avancer avec prudence, parce qu'on ne va pas lâcher trop vite ou avoir trop de mesures lâchées et puis après avoir une autre éclosion.
Merci, docteur. Opérateur, prochaine question.
Merci. Next question is from Andrea Gunn from the Chronicle Herald. Please go ahead.
Hi there. I've heard a lot of questions about just like restarting the economy and what sort of metrics are going to be in place and how it's going to be decided about that. But I'm wondering more just, and I don't know who the best person to answer this question is, but about when people or when we can start looking at or how we're looking at relaxing some of the social restrictions. So perhaps for people who live alone, for people who might have a family member who is sick with cancer or who is experiencing depression, like when can we start considering the option of maybe like having small gatherings and kind of reducing some of the more like social family related restrictions that have been in place?
I think we'll ask Dr. Tam.
Those are the very kind of discussions that we're having with other chief medical officers. And obviously, the really key thing is to get the epidemic wave under control. So when we're seeing that peak, it means that we still got the sort of downward slope of that curve, if you like, and you need to get to the bottom of that wave. And so that's primarily from a purely epidemiologic perspective. But we know life is not just about the health aspects, it's about social and economic aspects as well, and how to essentially begin to change the way that we approach our daily lives. I think we're going to be living with COVID-19 for some time because we, even after doing the sero survey and understanding the immunity of the population, one would suspect that quite a large part of the population is still not immune. And so we will be having to live in a new normal, as we were trying to say, with this virus. So we're very in tune with the need to address psychosocial and mental health aspects as well. So we are, that's very much an area of active discussion. I think part of it is to be able to do continue to do some of the physical distancing and reduce the spread while beginning to sort of get back to some of those aspects of our daily lives. So we are systematically thinking through those different settings and how we can, very cautiously and thoughtfully approach that. And so I think, that's what's actually undergoing the most active discussion right now.
Yeah, okay, so that sort of answers my question, but I guess there's a lot of provinces that are talking about ways to sort of trickle open the economy and kind of get a few sectors back on track and that sort of thing, and it's been talked about a lot. So can we expect to see like maybe some social measures relaxed around the same time that some of the economy measures are relaxed, or is that going to be a longer wait for that, or do you just not know at this point?
So right now, our very singular focus is getting that first wave under control. So I think while we're experiencing a slowdown of the epidemic curve at the national level, we have different epidemiology across the country. So I think every jurisdiction is making sure you're absolutely certain that that epidemic is under control and that you can detect any resurgences and be able to manage them. So I think that's so key. But recognizing that, the weather is actually improving and we need to get people outside is ensuring the public will know how to adapt their behaviors, making sure that they can still go outside, but maintaining those physical distancing or other measures that we can take as well. And so that's the kind of thing that we're very seized with at the moment.
Thank you, Doctor. Operator, last question on the phone, please.
Dernière question est de l'Inaudible de la presse canadienne. À vous la parole.
Oui, bonjour. Je voudrais revenir sur la question de l'envoi de militaires au CHSLD. Monsieur Trudeau dit que c'est pas encore décidé. Est-ce qu'on peut avoir une date? Parce que la demande est arrivée hier, mais vous le saviez déjà depuis un certain temps que le besoin était là. Alors, quand est-ce qu'on va voir des militaires dans les CHSLD, ces 1000-là au Québec?
Bien, merci pour la question. Effectivement, la demande est arrivée hier dans un contexte où on comprend à la fois l'urgence et l'importance de la situation. Au Québec en particulier, les aînés vivent des moments très difficiles, mais les préposés, les infirmiers, les infirmières et tous ceux qui travaillent fort dans les milieux de soins de longue durée vivent aussi des moments très difficiles. Et les familles qui s'inquiètent pour les aînés et pour les travailleurs vivent aussi des moments très difficiles. Et c'est pour ça qu'on travaille à vitesse grand V. Le ministre de la Sécurité publique, le ministre de la Défense nationale sont déjà en contact avec leurs homologues au Québec pour que cette aide qui a été demandée hier soit bien comprise et rapidement apportée par le gouvernement canadien, toujours évidemment sous le leadership du gouvernement du Québec.
OK, donc vous n'avez pas de date, M. Duclos. Oui, je n'ai pas entendu de date, c'est dommage. Madame Freeland, peut-être revenir un petit peu sur ce que la ministre Hajdu disait tout à l'heure à propos d'un projet national qu'il faudrait avoir après pour la question des soins aux personnes âgées. Est-ce que vous êtes en train de dire que ce champ de compétences qui est purement provincial devrait peut-être être un peu empiété pour qu'on prenne mieux soin des personnes âgées au Canada?
Non. Et je veux souligner ce que Jean-Yves a dit, c'est que le Canada était là pour le Québec, le Canada est là aujourd'hui pour le Québec et le Canada sera là pour le Québec. C'est vraiment une crise nationale, une crise de santé nationale et une crise pour nos années nationales. Et nous comprenons que nous devons jouer comme équipe Canada. Concernant ce que la ministre Hajdu a dit, je pense que tous les Canadiens comprennent que la situation avec nos aînés autour du pays est une tragédie. Et aujourd'hui, on a une crise, on doit répondre à la crise d'aujourd'hui. Mais je pense que tout le pays comprend que nous, ensemble, devons faire mieux pour nos aînés, pour nos parents et nos grands-parents. Les détails spécifiques, exactement ce qu'on doit faire, ce n'est pas le moment de parler de ça ou même de planifier ça. Aujourd'hui, c'est le moment de sauver les vies. Mais je pense qu'il n'y a pas même un débat dans notre pays sur la question « Est-ce que nous devons faire mieux pour nos aînés ?» Absolument, oui.
Thank you, Deputy Prime Minister. Tonda?
Tonda McCharles, Toronto Star. Could I get a clarification first on the announcement today? As I read it, it does not include, and I think this is for Minister Hajdu, it does not include any research in Canada in hospital-based research institutes for non-COVID research. And all non-COVID research and clinical trials have been suspended or cancelled because those places have no funding, and they've appealed to the federal government for help. Are you doing anything in this announcement today? Or if not, when will you?
I'll just in general point to my colleague, Minister Bains, who could probably speak to this in a greater capacity. But I will say, and I will remind you that, in fact, I think we're in the position that we are in right now to be able to pull together such an amazing consortium of researchers and academics because we've invested in science over the last several years. And so, Minister Bains, you can perhaps take the details of that question. Thank you.
No, thank you very much for that question, Tonda. And Patty is absolutely correct. Yesterday, for example, when we put out measures to support the research community, we allocated a significant amount, close to $300 million, to support researchers, people that do focus on research, the technicians as well, to help them with some of those wage subsidy initiatives that they necessarily did not qualify for. When it comes to health-related research and individuals that are engaged in that ecosystem, we're working with them to find a solution as well to support them on a going-forward basis as well. But the announcements we made around through the tri-councils in terms of grants and research amounts of monies and fellowships, those have all been extended to continue research in other areas to support those researchers. And we're also working with healthcare-related facilities as well and research-related initiatives to support those researchers and their support systems as well.
And I think Dr. Nemer has something to add.
Yes, I would just like to clarify that the reason the non-COVID clinical trials were stopped is the same reasons, that some other surgeries were stopped in hospitals. It was their wish that they wanted to focus on COVID response and not put unnecessarily lives in danger. So I think that everybody's very much looking forward as well to having the healthcare system resume, because people are still getting ill and we still need medications and clinical trials for other diseases.
I think this is for Dr. Tam. Dr. Tam, 2 weeks into the sort of shutdown, you were saying we need to wait 2 weeks to see if the measures will work. And then when the government finally got around to releasing its modeling in early April, you said, well, we still need, that's a picture from 2 weeks back. We need 2 more weeks. Now we're 2 weeks in. When is the government going to release actual modeling? And what does your agency mean when you say you've released a synopsis of models internal and outside?
Well, just to reiterate, modeling is for planning. This is not real life. It's simulations for planning purposes, and they do have to be updated as the situation arises. So modelers will always say, when that models will never be actually right. They are there for planning purposes, and it plays at different scenarios in order to provide us with some of the parameters that we need to look at as we look forwards. But the reason why all the provinces are doing the same is that you have to look at what happens next in these phases, because we actually don't know enough about the trajectory of this virus. We're learning about it every day. And so what I tell you last week or 2 weeks ago may very well undergo changes as a result of new knowledge. One example that I provided was the fact that the proportion of people who have COVID-19 who die is changing as we speak in terms of the Canadian epidemiology because of the tragic outbreaks that is going on in long-term care facilities. A month ago, you may not have seen this many outbreaks. And then as the outbreaks develop, all of those parameters have to undergo evolution. And therefore, planning, they do not tell you the exact numbers. So, and we will provide an update. Many jurisdictions have this week already. So we're looking forward to doing that as well. But different jurisdictions at the provincial level are using modeling, for example, to look at their ICU beds. And that's not the kind of modeling that we would do at the federal level, for example. So a different kind of models that answers different questions for different reasons, and we can pose different questions to modelers as we go along as well. So it's a dynamic process, and so it's. I think our modelers have consulted with at least over 30 different experts in order as they develop the models, and they look at the published models in order to inform what they're doing. So it's not a single model, but it's taking into account all the published parameters and variables as they change. So that's the dynamic process, but we are looking forward to providing an update. I think it's tomorrow.
Marika
Walsh with the Globe and Mail. Dr. Tam, a Conservative leadership candidate questioned your loyalty to Canada this week, and I'm wondering what you thought of that and what your message to him would be. I think we'll ask Patty to begin the answer.
I'm certainly happy to take that, and then if Dr. Tam chooses to add anything, it's certainly up to her. I think Canadians have been pulling together through this crisis. It's one of the things, actually, about one of the aspects of COVID-19 that has been the most heartwarming is seeing people pull together, whether it's politicians in some cases at the provincial, federal level, where we may have had fractious relationships prior to COVID-19 and now are working very well together and very collaboratively, whether it's at the community level where businesses have banded together, changed their business practices overnight to meet the need of the health sector and many other sectors, whether it's individual citizens volunteering to deliver food to food banks and through food banks to people that are isolated at home. It's just unbelievable. And so I think that is the only way through a crisis, actually, is to pull together and to work together in a spirit of kindness and compassion and bravery and courage. And that is how we get through COVID-19. In regards to our public officials, who, by the way, are working around the clock to serve Canadians, and in particular, Dr. Tam and her team, I have nothing but profound respect and appreciation for that. I know many people are not inside the walls of government and can't see how the sausage is made, if you will, but I do, and I get calls. I spoke to my deputy this morning at 5:45, and I will likely speak to him this evening before I go to bed, and that won't be till later tonight. And in between that, these officials are holding meetings, calling people, getting information and data that we need, working with scientists and researchers, providing the government regular updates, holding media conferences, and doing everything in between. And I am incredibly proud to be a Canadian and to have such an amazing civil service that serves us every day at the expense of their own families, at the expense of their own needs, their own personal needs for sleep. We should be grateful to the civil servants that serve us so diligently and with such compassion. And so with that, I will see if Dr. Tam wants to add anything.
Not much. I'm a pretty focused person and I work really, really hard. So, probably over 20 hours a day just to my singular focus is to work with all of my colleagues to get this epidemic wave under control. I don't let noise sort of detract me from doing that. So that's how I work. And I think, as I took on this job, I know that, as I say, the population is my patient. So this is how I look at the Canadian population. And I'd never do this alone. So as the CPHO, I harness the power of the collective to promote health and prevent illness and control outbreaks. And so that much I know is that I only represent a very small aspect of the public health response in Canada, and I'm really proud that I'm part of it. So.
Thank you, Dr. Tam. Ceci met fin à la conférence de presse pour aujourd'hui.